But is it happening? So you go and see the rural areas wherever, people who have built these toilets, they're being utilized for some other activities. They're even, using it as an animal house. So people are refusing to use that. And you go and say this has to be banned. Defecation in the open fields. There are a group of people who fight with you. They say this acts as a manure. So lot of resistance from our people. So this goes on. So imagine one person with hookworm infestation is the one who is giving this infection to all the people in the community. So proper sanitation. So teach them to use toilets for defecation. Very important. And not walking barefoot. At least wearing footwear. But how many of them are they comfortable with the footwear working in the fields? So this is still a problem. That's why we say if we cannot fight all this, at least you treat them. So before you treat iron deficiency, we say all these people have to be given an anti-helminthic. Whether it's an albendazole or mebendazole. That's why we say for everybody, at least once in 6 months, let us give this anti-helminthic, which can probably take care of the infestation, whatever it is in the body. Then, constant latrines, I told you. Educate to wash hands. When do we wash hands? Or when should we wash hands? After eating. All our school children say, after eating. So nobody knows. We don't need anybody to teach us to wash our hands after eating. But I tell you, not just before eating. Very important is where hygiene comes as after, to wash hands after defecation. So many of our people do not practice this. And apart from that, as you're all working in the laboratory, not just people who are working in the laboratory or who are with the contaminated, work with contaminated material, hand washing is very, very important. So it prevents many diseases. We can say up to 70% of diseases could be prevented by proper hand washing. You must have heard of a story of typhoid Mary. Mary who was a very good cook, a teenage girl who used to cook very well. She was employed to cook in a family. So once she started cooking, there were some GI disturbances in that family. So they had abdominal pain, diarrhea and all that. Then they sent her off. They said, enough, we'll cook our food, please go. And the neighbors who were there, who knew that she was a very good cook, they were very happy. So they employed her. A similar thing happened in their family too. So they also sent her off. She was again employed because she was a very good cook. So she was employed by another family, but to their bad luck, so they lost Dobby who was in their house. So then they knew that there was something wrong with this girl. Wherever she went to cook food, so there were some similar illness and one life was lost too. Then they suspected that this girl has a disease. She must be a carrier. So when they wanted to test the blood of this girl, she refused, she rejected. No, you need to take a consent too when you want to do a test from any individual. So then, with the help of police, so they got her blood and tested. So Vidal was positive. What is this Vidal test done for? Salmonella typhi. So she was a carrier. She never suffered from the disease, but she became a carrier. So lot of organisms were multiplying in her gallbladder. So she used to defecate the organisms. See, unhygienic practices. So never washing the hands thoroughly. So whatever vegetables she was cutting, or whatever we eat raw, cooked food is better. So it kills all the organisms, disease causing most of the organisms. So she was transmitting the bacteria to everybody. So that's why she was called as Typhoid Mary. She was treated, then she was trained for something and she was made a laboratory technician too later. They gave her some training. That's why we say the practice of hand washing. All of us must and should follow that. No? Not the fomines which are there. How did H1N1 spread? Many people started wearing a mask very well. It was not just the mask which was preventing. anything, we say please do not handshake. So a person with cold, how do we get this common cold? A very common viral infection. Person may sneeze, he may just sit by our side and go. So whatever secretions we touch, it has viruses. H1N1. So lot of sneezing and cold and running nose and the mucus discharge which was there. So just touch through your hands. Then definitely nobody keeps washing their hands 24 hours. So the same hand being used to touch all the objects. So you close your door and your friend asks for a pen or pencil, whatever. Notes, nothing. So we may say we don't touch anybody or any item. But money, how so we don't say somebody gives money or when it is. So it was, even spreading through that. So virus by contact. So such contaminated hand, just touch your nose, even eyes, They used to, even through the eyes, the virus used to enter into the respiratory tract. So that is how, that was a way like all these organisms were being transmitted, especially H1N1, even the common cold what all of us get. So she was a very good example for the contaminated hands, transferring. That's why I say whenever this is summer season, bacteria multiply very well. So if you are on a tour, if you are going anywhere, so you like to eat idli, right? But eat sambar with idli. So say no to the chutney. Lot of bacteria will multiply. Even this curd, buttermilk, what sir was talking about, though it's good, we don't know which water they use to prepare buttermilk. So anything that is uncooked, your kosamri and all that, please say no to it. Don't eat. So these are the ones which transmit any sort of bacteria to us. If such, we don't know food handler, how it is being prepared in the kitchen. So those of you who stay in the hostel, see that your people who handle food, cook is healthy. So spend from the pocket, so pay, get him some albendazole, mebendazole, and see that he is devoid of all helminthic diseases, so that all of us could be healthy. That's one of the important things. Next. That's the last one. This, I told you about how well it is transmitted. That's just the larva, visceral migrants. Many people do not have that reaction. I told you how it enters into the body. Next. Yeah. So hand washing. I know if micro people are there here. Yeah. You know about hand washing? How you wash your hands? Yes? How do we wash our hands? You should go to schools and ask them, So very nicely they show. Yes. So how do we wash our hands? Very nicely rub the hands and show. So then children also say when we get up in the morning, similar way we rub our hands. So this is the way we wash our hands, and most of the areas that are not covered or cleaned are shown very well here. Look at the red color. So however you wash, the routine practice. So these are the areas which are not cleaned at all. So proper washing of the hands. I'm sure all of you know because you're all working in the laboratory. So just take 20 seconds to wash your hands thoroughly. Not just once after you come out of your laboratory. So before having food, after defecation, so in between, keep washing your hands so that you keep many of the diseases away. So hand washing, so very, very simple technique that prevents or takes away all the germs that are there. So please cut your nails. So at least let it be less than 1/4 inch. So clean it. Otherwise we need to use a scrub to clean the nail bed too. So we do not reach that. So proper hygiene. So first point is, very important is, hygiene starts at our level. So by keeping our hands clean. I'm sure all of you know how to clean, so it could be an ordinary soap. So I don't advocate that it has to be an antibacterial or whatever soap, even ordinary. So we say warm water is better, but very difficult to get warm water. We say per person to be hygienic, to keep his body under good hygienic conditions, he needs to have about 25 liters of water per day. So someone has approached us, so hope we don't run short of water, at least to keep ourselves hygienic, and let us all drink water which is pure, which again prevents a lot of diseases. Yes. So with this, I say, let us identify iron deficiency, treat the deficiency. So if there is no deficiency, let us teach the community how to prevent iron deficiency, so that we would like to see, or we want to see, women who are healthy, happy. So in this health, women in the reproductive age group, if they are devoid of anemia, then we can expect our next generation to be healthy. So if you find a woman with iron deficiency, please spend money from your pocket. So the entire money may be about 200 rupees. So treat that woman for anemia. So give her a life, so that it's not just life you are giving 250 rupees, is giving her 25 years of happy life too. So thank you very much. Next. Yeah, no candles light while lighting another candle. So never stop sharing and helping others, because it makes your life more meaningful. So I want all the ladies to take up this, especially I'm addressing this ladies because still we are in the month of March. So not just month of March.